Question 231. Nurse Berlinda is assigned to a 41-year-old client who has a diagnosis of chronic pancreatitis. The nurse reviews the laboratory result, anticipating a laboratory report that indicates a serum amylase level of A. 45 units, L. B. 100 units, L. C. 300 units, L. D. 500 units, L. Question 231 Answer, C. 300 units, L. Question 231 Explanation, the normal serum amylase level is 25 to 2,315,231 units, L. With chronic cases of pancreatitis, the rise in serum amylase levels usually does not exceed 3 times the normal value. In acute pancreatitis, the value may exceed 5 times the normal value. Options A and B are within normal limits. Option D is an extremely elevated level seen in acute pancreatitis. Question 232. A male client who is recovering from surgery has been advanced from a clear liquid diet to a full liquid diet. The client is looking forward to the diet change because he has been bored with the clear liquid diet. The nurse would offer which full liquid item to the client? A. Tea. B. Gelatin. C. Custard. D. Popsicle. Question 232 Answer, C. Custard. Question 232 Explanation, full liquid food items include items such as plain ice cream, sherbet, breakfast drinks, milk, pudding and custard, soups that are strained, and strained vegetable juices. A clear liquid diet consists of foods that are relatively transparent. The food items in options A, B, and D are clear liquids. Question 233. Nurse Juvie is caring for a client with cirrhosis of the liver. To minimize the effects of the disorder, the nurse teaches the client about foods that are high in thiamine. The nurse determines that the client has the best understanding of the dietary measures to follow if the client states an intention to increase the intake of A. Pork, B. Milk, C. Chicken, D. Broccoli. Question 233 Answer, A. Pork. Question 233 Explanation, the client with cirrhosis needs to consume foods high in thiamine. Thiamine is present in a variety of foods of plant and animal origin. Pork products are especially rich in this vitamin. Other good food sources include nuts, whole grain cereals, and legumes. Milk contains vitamins A, D, and B2. Poultry contains niacin. Broccoli contains vitamin C, E, and K and folic acid. Question 234. Nurse Oliver checks for residual before administering a bolus tube feeding to a client with an esophageal tube and obtains a residual amount of 150 milliliters. What is appropriate action for the nurse to take? A. Hold the feeding. B. Reinstill the amount and continue with administering the feeding. C. Elevate the client's head at least 45 degrees and administer the feeding. D. Discard the residual amount and proceed with administering the feeding. Question 234 Answer, A. Hold the feeding. Question 234 Explanation, unless specifically indicated, residual amounts more than 100 milliliters require holding the feeding. Therefore options B, C, and D are incorrect. Additionally, the feeding is not discarded unless its contents are abnormal in color or characteristics. Question 235. A nurse is inserting an esophageal tube in an adult male client. During the procedure, the client begins to cough and has difficulty breathing. Which of the following is the appropriate nursing action? A. Quickly insert the tube. B. Notify the physician immediately. C. Remove the tube and reinsert when the respiratory distress subsides. D. Pull back on the tube and wait until the respiratory distress subsides. Question 235 Answer, D. Pull back on the tube and wait until the respiratory distress subsides. Question 235 Explanation, during the insertion of an esophageal tube, if the client experiences difficulty breathing or any respiratory distress, withdraw the tube slightly, stop the tube advancement, and wait until the distress subsides. Options B and C are unnecessary. Quickly inserting the tube is not an appropriate action because, in this situation, it may be likely that the tube has entered the bronchus. Question 236. Nurse Ryan is assessing for correct placement of a nasogastric tube. The nurse aspirates the stomach contents and checks the contents for pH. The nurse verifies correct tube placement if which pH value is noted. A. 3.5. B. 7.0. C. 7.35. D. 7.5. Question 236 Answer. A 3.5 Question 236 Explanation. If the nasogastric tube is in the stomach, the pH of the contents will be acidic. Gastric aspirates have acidic pH values and should be 3.5 or lower. Option B indicates a slightly acidic pH. Option C indicates a neutral pH. Option D indicates an alkaline pH. Question 237. A nurse is preparing to remove a nasogastric tube from a female client. The nurse should instruct the client to do which of the following just before the nurse removes the tube? A. Exhale. B. Inhale and exhale quickly. C. Take and hold a deep breath. D. Perform a Valsalva maneuver. Question 237 Answer. C. Take and hold a deep breath. Question 237 Explanation. When the nurse removes a nasogastric tube, the client is instructed to take and hold a deep breath. This will close the epiglottis. This allows for easy withdrawal through the esophagus into the nose. The nurse removes the tube with one smooth, continuous pull. Question 238. Nurse Joy is preparing to administer medication through a nasogastric tube that is connected to suction. To administer the medication, the nurse would A. Position the client supine to assist in medication absorption. B. Aspirate the nasogastric tube after medication administration to maintain patency. C. Clamp the nasogastric tube for 30 minutes following administration of the medication. D. Change the suction setting to low intermittent suction for 30 minutes after medication administration. Question 238 Answer. C. Clamp the nasogastric tube for 30 minutes following administration of the medication. Question 238 Explanation. If a client has a nasogastric tube connected to suction, the nurse should wait up to 30 minutes before reconnecting the tube to the suction apparatus to allow adequate time for medication absorption. Aspirating the nasogastric tube will remove the medication just administered. Low intermittent suction also will remove the medication just administered. The client should not be placed in the supine position because of the risk for aspiration. Question 239. A nurse is preparing to care for a female client with esophageal varices who just had a Sangstaken Blakemore tube inserted. The nurse gathers supplies, knowing that which of the following items must be kept at the bedside at all times? An obturator. B. Kelly clamp. C. An irrigation set. D. A pair of scissors. Question 239 Answer. D. A pair of scissors. Question 239 Explanation. When the client has a Sangstaken Blakemore tube, a pair of scissors must be kept at the client's bedside at all times. The client needs to be observed for sudden respiratory distress, which occurs if the gastric balloon ruptures and the entire tube moves upward. If this occurs, the nurse immediately cuts all balloon lumens and removes the tube. An obturator and a Kelly clamp are kept at the bedside of a client with a tracheostomy. An irrigation set may be kept at the bedside, but it is not the priority item. Question 240. Dr. Smith has determined that the client with hepatitis has contracted the infection from contaminated food. The nurse understands that this client is most likely experiencing what type of hepatitis? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Question 240 Answer. A hepatitis A. Question 240 Explanation. Hepatitis A is transmitted by the fecal-oral route via contaminated food or infected food handlers. Hepatitis B, C, and D are transmitted most commonly via infected blood or body fluids.